Welcome to Think Big with Dan and Qasim. Join hosts Dan Melnick and Qasim Masood as they explore big ideas, limitless possibilities, and engage with visionaries, entrepreneurs, and thought leaders who dare to dream big, get inspired, motivated, and find practical tips for personal growth. Think big, dream bigger, and ignite your potential.
All right, welcome to Think Big with Dan and Qasim. And if you want to go ahead and introduce yourself, tell us where you live and what you do for a living.
Absolutely. Wayne Gillis. I live in Great Falls, Montana, and I'm the CEO of Great Falls Health Network here in Great
Awesome.
Falls.
Awesome. So can you just tell us more about Great Falls Health Network and how you got the idea for it and really just what it's all about?
Yeah. So for here, the clinic was probably in existence in the Great Falls for probably a little over 100 years. The hospital's been the last 20. And so it's continued to grow. And as we've looked at healthcare, there's the acute side of healthcare where you've got, somebody has surgery or they have an acute illness, but then there's the healthcare continuum is much more complicated than that, right? Especially as people get older and, they have more disease processes. Now you really need to think of it as a continuum. And so kind of the network for us is it's like this circle. So we've got 5 clinics, multi-specialty. And so when we look at, preventative care and, health and wellness, but also when we have acute illnesses and issues, right, they need that support and follow-up care after they're discharged from the hospital. And so we want to have all those pieces connected. What we have found is, and I think there's lots of studies out there related to this, that when there is a continuum where there are connections within healthcare, the outcomes are much better because, you don't have people falling through the cracks. A lot of times you'll get somebody with a new diagnosis of diabetes, and if they don't have the follow-up care, we can get them stabilized in the hospital, but really they need to learn to live with that disease, right? And they need to have that clinical and physician support in order to be able to do that.
For sure. So does the health network cover the hospitals or like what exactly is covered within like the health network?
It's hospitals, clinics, so it's outpatient, inpatient, emergency room. We have surgery centers. We have, PTOT speech. So there's therapies in the hospital as well as out of the hospital. So it's the beginning, during the acute and then also at post discharge. Only thing that we have partners within like a skilled nursing facility. So we don't have that as, a part of our actual business umbrella, but we have partners that we work closely with.
For sure. So as a CEO, like what does a typical day look like for you?
That's a great question, Dan. It changes a lot. I think for me, it probably will be a little different in a few years from now. Right now, we've been on a big aggressive growth track. And so it's really been about, building the right strategies. We've got a lot of construction. We just expanded. So I opened a 3-story tower, staffing that, recruiting the right specialties, looking at, when we think about the right staff, the right education, how do we market to our constituents with the new service lines? And so there's a lot of growth and building. And so I'm in the community as well as, working with the hospital development team for us to make sure, one, we're doing really good planning and that we, have the right steps and rolling out the right things at the right time, but also making sure that I've got the right talent in place and looking at those leaders and continuing to build them. Because what I've been, this is probably the 4th system that I've worked in my 30 plus years. And, when you have a lot of growth, you have sometimes it's a big change for people, right? And so you need to make sure that your leaders are equipped for that. And so they need coaching and mentoring, and you need to set them up for success.
For sure. So in terms of that, like how do you make sure, because I think that for a lot of people and like in the health system, just in general, staffing and finding like the right people is a huge challenge. So how do you make sure that you do have the right people and that even as you grow, that the people you have are equipped for that? Like, what does training look like? I'm just curious about those things.
That's a culture to me is the biggest, most important thing, I think, honestly, Dan, because when we look at healthcare providers, whether it's physician or, clinical staff, there has been a decrease over time of admissions into medical schools, into nursing schools, into respiratory therapy schools, et cetera, right? So that the population or that N number, right, is lower across the nation, and there's more competition for that. That got more complicated with COVID because, you had a lot of people that went to traveler positions because they were paying these insane amounts of dollars, which impacted the hospital bottom line pretty significantly across the nation. It was a big contributor to a lot of the hospitals closing because you had millions and millions of salary dollars that, were not compensated on a revenue side. And so for us, we had very few travelers. We were fortunate, but we've really focused on culture. That has been a huge thing for us. We've got my style is my doors open. I round, I'm at orientation, I send a newsletter out to the whole entire team. I have frontline staff that reach out to me. EVS comes in my office. I want that kind of relationship. That's important to me because it's personal. What we do is personal, right? We are taking care of people at their most vulnerable state. They have to trust us. That is a big deal, right? That is super, super, super important to me and the team. And I need to make sure the organization, has that kind of same thought process. And so when we are looking for new team members, cultural fit is our first box to check, to be honest with you, because I can teach skills. I can't teach empathy. I can't teach high emotional IQ and EQ. I can't teach those things. Those are innate in people, and people that have the right drive because they were in healthcare for the right reasons. That is something that, everybody goes into their roles sometimes for not always the right reasons, right? And we want to filter those people out. The other piece to that is we, have adopted kind of a continuous improvement model, and we have, our strategy deployment that's integrated into that. And so what I mean by that is that when we think about overall hospital goals and our strategic objectives, I want to have all those objectives clearly tied down to the frontline staff. And what I mean by that is their pieces that they own, that they can impact, they need to feel connected to that larger goal because that gives people purpose. And with continuous improvement, you decentralize how that work is done, how those decisions are made. When I think about a nursing unit, even though I'm a nurse, I am not the person that should ever be making decisions at a nursing unit level. The director shouldn't be making decisions at the nursing unit level. They're too far away from it. That empowerment needs to be given to the frontline staff. And so the continuous improvement drives the decision-making down to the frontline staff. That is hugely empowering, and it has motivated and has impacted retention. It also has impacted our recruitment because people have control over their environment. They have control over their own destiny, right? And the majority of people want that. And so that has been a competitive edge for us. The other thing with that is that we optimize things, efficiencies, et cetera, but it's also dramatically impacted outcomes. We're a 5-star hospital, have been 3 years in a row. We are top 100 for orthopedics. We just started open heart, and we're heading towards a cardiovascular center of excellence. All that's happened in a really short amount of time, despite being through COVID, doing all those things. And it's because we have the right team focused on the right things.
For sure. So like as you guys are expanding in terms of getting like the word out to people in your community, what does that look like? Is it going on news stations? Like, is it running ads? What does that look like for you guys?
That's a great one. We've actually what's the right word? Governed that. This is why I say that. So we were a 19-bed hospital. We've just gone to just under, I think we're 74 now. And we were running a census of 30. and 19 beds. So the math doesn't work, obviously. And so we've never advertised our ED. And we've never advertised most of our services. It's all been word of mouth. And so I have held back on that until we got the tower open. The tower's open now, but it's also a big change for our organization. It goes back to the people piece, right? I've got to make sure I have the right staff with the right training that have been oriented, and we're ready to receive those patients and we're ready to give excellent care. And so I have to kind of gauge that. And so we've got the units open, but I'm probably going to do a soft kind of opening from the standpoint. Everybody knows we're open, but we haven't dug into, like, we don't advertise our quality metrics, and we do a really good job. So like our orthopedic program, we're the only one that has top 100 in the state of Montana and the state of Wyoming. And so we don't advertise that because right now, previously I didn't have the space. I didn't have bed capacity. That's changed now. But I don't want to open the doors and not have the staff, right? So we have to blend those two together. And so that's going to happen over the next months as we continue to kind of roll different service lines out.
For sure. So obviously now in 2024, many organizations and companies are looking for the best use case for things like AI. So do you guys use AI? And if not, like, where can AI help out your business?
Boy, that's the hot topic, isn't it?
Yeah.
There's minimal use of AI today. Some of it's in our revenue cycle team. I think there's huge use cases for it. I am super, super excited about it because if you look at, so let's just start with coding, right? If we think about the medical record and somebody that's been in the hospital for 4 or 5 days, there's hundreds of pages of documentation, right, of what's happened to that patient during that 5-day period. When somebody goes to code that, they're not going to look at every single page, right? It's not humanly possible to look at hundreds of pages, but AI can do that, right? It can read all those documents. It could formulate that. It knows what the ICD codes are. It knows what the coding rules are. All that stuff could be built in the algorithm. And that picture, summation could save a lot of clinicians and coding time that would actually represent and reflect really the care that was delivered. And so there's that's just one little simple use case that I think could be massively impactful for us to actually kind of represent bringing key things forward, but also actually advancing what we do from a diagnostic standpoint, because it would summarize those things that would be easier for the provider to be able to say, okay, where are we at in space and time? And this lab's changed, and it kind of makes it easier for them to be able to pull the picture together.
For sure. I mean, but what about AI maybe for like booking appointments? Maybe like somebody has, questions, they can like, book an appointment via like a chat, on your website, something like that.
I mean, we have some of that now.
Okay.
Honestly, I think the younger generation likes it. The older generation does not. And so I think for them, our population is, we have a fair amount of our population that are probably over 55. I would say it's at least 50%. And so booking their appointments online and, being able to go through the chat if they have questions, or using the office assistant, et cetera, like through our outpatient platform, all those, the younger generation embraces that, right? They love it. They think it's fabulous. They want to pay their bill and not talk to anybody, all those kind of things. That is not the case with, somebody over 60. They want to still drive here. They want to go to the business office. They want to hand you their check. They don't want to do anything electronic, right? So we're still in that kind of, we have to kind of hit both of those markets. That'll eventually kind of, change over time. But right now we're kind of in both worlds.
Right. Yeah. I mean, that's important to really understand your customer because, yeah, like you want to make it easy as possible for both people to kind of do things how they want to do it. So, in terms of the organization, like, what would you say is like your top priority now, like in the next few months?
I think executing on our strategies that we have for 24, and that's really about, we've got a plan on how we want to fill the beds. We know the service lines we want to continue to grow. And really, it's about getting the physicians and the staff in place for us to kind of meet those demands. We have a huge amount of demand. And so that is exciting, but we want to meet it and we want to do it well. So that's really that would be probably that's going to be our biggest focus this year.
For sure. So what would you say is like the one biggest piece of advice that you wish you knew before you started in your career?
Oh gosh. That's a hard question for me to answer. The reason why I say that is because I never saw myself as a CEO. I I just don't think that way, I guess maybe. I'm not sure. I don't know if I would have ever even went for this role if somebody hadn't seen that skill in me. And then when they kind of saw it, then they helped me see it. I think if you want to move up in healthcare and you kind of know where you want to land on the administrative side, I would probably look at when you're thinking about higher level education, you kind of need to think about where your market is and really what you're looking for. I think it is, if you go the MHA route, I think based on that, because you end up with internships the last, semester of your education, I think it does help you kind of move into administration faster. I think my caution would be that you need to make sure that you understand your weaknesses and where your gaps are. You can fill that in with surrounding people that have those strengths that you don't have, but you need to be open to that and you need to make sure that your ego doesn't get in the way because of the role that we are in, right? We wield or have the ability to have a tremendous amount of influence, and we can make decisions that could potentially not be in the best interest of patients. And so somebody in my seat needs to understand the gravity of that.
For sure. So if we're going to have this conversation again in 1 year from now, where do you see things going for the business?
For here, I see the network larger. I think we'll be planning another expansion after that, and we already have some tentative plans to add more beds. I see the network wider, and what I mean by that is, Montana's pretty rural, much different. I'm from the East Coast, so much different than along the East Coast where there's lots of hospitals, kind of all over the place. It's normal for our patients to drive 2 and 3 hours, to come to
Wow.
the hospital. Nobody would ever do that on the East Coast. If
Right.
they drive past 20 minutes, they're not doing it.
Mhm. Yeah,
And so it's because they have access, right? There's just a ton of access. We don't have that. And so for us, I think when we start looking at there's our kind of central market, and then you start getting outside of that. And so when you kind of get into those secondary and third tertiary markets, I think then we need to start getting and thinking about strategically, what do we do for clinics and how do we set some of that support clinic space up there? And for outpatient procedural things, what can we put in some of those key locations where we've kind of got to draw, because we want to make it easy for them, and just that kind of extending that coordinated care model, I guess, would be probably one of the biggest things that I would want to do over the next year.
for sure. And that's exciting. So if somebody watching this wanted to reach out to you, do you mind sharing your website or social media? I guess best ways to get in contact with you.
Yeah, yeah, absolutely. The website would be Great Falls Hospital. Let's see here. Make sure I don't. It should be www.gfclinic.com. As far as contacting me, absolutely. They can contact me directly. I'm happy to meet with anybody, help them, guide them. My email is wayne.gillis@gfclinic.com.
Awesome. Well, Wayne, thank you so much for your time today. Of
Oh, it's a pleasure. Thank you very much for having me. I appreciate it, Dan.
course. Thanks. All right. Bye.
Have a good one.